World of Travel by Irshad Malik.
Audio stream across the world on radioalansar.co.za.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين بالصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise is due to Allah, the Lord, cherisher, nourisher, sustainer and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is only you that we worship and it is your guidance that we seek. Ya Allah, keep us in the straight path. Ya Allah, shower us with the choice of blessings. Ya Allah, shower us with your mercy. Ya Allah, guide us. Greetings, salam, salutations on our beloved Nabi Muhammadur Rasulullah sallallahu alaihi wasallam. Yes, it's time for Medical Files and we welcome you to Medical Files brought to you by the Islamic Medical Association of South Africa and presented by myself, Faisal MJ Sulaiman. Assalamu alaikum wa rahmatullahi wa barakatuh and thank you for joining us. We welcome our listeners on Radio Al Ansar, CII Radio, Voice of the Cape, Radio 786 Sirius FM, Radio Islam and IFM Port Elizabeth, and all listening to us on audio streaming and other platforms. Our topic for discussion is Down's syndrome, and our guests are on the show are Dr. Mark Mudley, a specialist pediatrician practicing at Umhlanga, and Jamila Mayat, a registered behavior therapist practicing in Durban. Dr. Mudley, good morning to you. Thank you for joining me on the program.
Good morning, Faisal. Normally it's good evening to you. But
I know.
I'm glad to be on studio.
In fact, I was about to say that Mark Mudley needs no introduction to the show. Is a familiar voice, if you say, on these airwaves. And I thank you for joining me. And of course, Jamila Mayat, assalamu alaikum wa rahmatullahi wa barakatuh to you.
Wa alaikum salam. Jazakallah for having me.
It's an absolute pleasure having you on the show. And I introduced you as a registered behavior therapist. That's the first time I heard, somebody in this field. Who or what is a behavior therapist?
A behavioral therapist generally works with children that are on the spectrum, special needs, but also neurotypical children as well that have behavioral challenges that might be affected by either the environment, perhaps a change in their situation at home. So a behavioral therapist works with collectively or collaboratively with the child's family or within the school environment to address behavioral challenges for kids.
Thank you. I just needed clarification so that we know. Of course, I said, Dr. Mudley, I'm not going to introduce you because if I'm going to read your CV, then half the show is going to be over.
Yeah.
And every time I've got to amend the last part, and as appeared, we start off with 2 shows, and now I think we're sitting on about 12 or 14, if I'm not mistaken. Anyway, Dr. Mudley is a specialist pediatrician practicing at Umhlanga and at several other hospitals as well. Our topic for discussion is Down syndrome. Dr. Mudley, let's start with you. What is Down syndrome?
Okay, Faisal. So Down syndrome is a genetic condition. It is inherited. So we all have 46 chromosomes. And Faisal, I know the medical terminology, don't want too much of it.
Yeah.
But Down syndrome, we have to get a bit medical here.
No issue.
But I'll break it down. So your chromosomes are what contains your DNA that makes you as a person. We get 23 chromosomes from our dad and 23 from our mom. That gives us a total of 46 chromosomes. Down syndrome, the 21st chromosome set is not 2, but there's 3. And that gives the diagnosis of Down syndrome. But as we go on, we'll explain it further.
Jamila, you're looking very excited. And what you call us now, I think you want to comment on that from a behavioral perspective.
Okay, so from a behavioral perspective, you would normally see or identify with Down syndrome, the challenging behaviors there are they face challenges such as communication difficulties, social skills deficits, attention deficits, emotional regulation issues, repetitive behaviors, which are commonly known as STIMs, which I will explain a bit later, sensory sensitivities, behavioral rigidity, and impulse control. So those are just some of the challenging behaviors identified with people or individuals with Down syndrome. However, you can't diagnose a person or identify them as Down syndrome based on a behavior. But these are just some of the challenging behaviors that are displayed by people with Down syndrome.
And Dr. Mudley, what are some of the physical characteristics of someone with Down syndrome? I mean, how do they manifest?
Yeah, okay. So the physical characteristics are quite vast. One can always go from head to toe. So when a baby is born, one should look for those specific characteristics. So they have a very flat head, very small face. They can have abnormal slanting eyes. A lot of them have tongues that's protruding. Their necks are very short. The lines on our palms, we have many lines. They have a single line that runs across the palm. And what they have is called a sandal gap. So when you wear a pair of sandals, that space between the big toe and the second toe, there's a big space between that. We call that a sandal gap. So those are your typical features of the child with Down syndrome. And the very floppy babies, they don't have good muscle tone, they have feeding difficulties, etc.
Jamila, you are smiling, I see. I'm just trying to adapt behavioral therapy to Down syndrome.
Sure.
Now, how can behavior therapy help address specific behavior challenges in individuals with Down syndrome?
So, behavior therapy can help address specific behavioral challenges in individuals diagnosed with Down syndrome by using evidence based interventions to teach them new skills. We also use these interventions to modify behavior and promote positive outcomes. Techniques that we use include reinforcement, social skills training, sensory integration, and cognitive behavioral interventions. So there's various evidence-based approaches. We can't go on a one-size-fits-all approach with any individual, regardless of the diagnostic. So it's very, very individualistic. So we will run a functional behavior assessment, which requires observations, interviewing with caregivers, teachers, and then from there, we will derive functions of behaviors, which are the cause or the reasons why they display certain behaviors. For example, a child could be crying in a specific situation, and the function of that behavior could be anything. Whereas, like, for example, two people could be crying in the same situation, but the reason behind that crying could be various reasons. One could be trying to avoid the demand of the situation, and the other one could be having a sensory meltdown. So for that reason, in order to implement an intervention, it requires a functional behavior assessment first. So it's all evidence-based, but backed by data.
Yeah, I actually like what Jamila said, because she describes the behavioral aspects of it. And Faisal, I'm sure with our previous shows, when we discussed autism and ADHD, we brought up similar behavioral patterns.
Absolutely.
So Down syndrome could also be a cause of that behavior in a child. Yeah.
Now, Mark, how common is Down syndrome?
According to CDC, this is a Center of Disease Control. This is a global institution. Per year, there's 6,000 births of children that have Down syndrome. I recently read on an article, I think it's Autism Gauteng, 1 in 500 babies in South Africa is actually born with Down syndrome. So that makes it a bit of a higher number compared to global statistics. Country-wise, we find Ireland has the most amount of children with Down syndrome.
So it is something that's growing?
It is something that's growing, but I think we are picking it up more easily now.
And what is the cause of Down syndrome?
So the cause of Down syndrome is basically a genetic cause. Like I said, it's your 21st set of chromosomes where an abnormality occurs. And we get 3 subtypes of Down syndrome, and I'm going to be super medical here because there's no other way to describe it. So the most common type is called a non-disjunction. Second most common type is called a translocation, and the third type is called mosaicism. These terms are quite intricate, but what we are trying to say is that each type, there's a certain or different defect in that 21st chromosome that predisposes that child to having Down syndrome.
Just to remind our listeners that this is an interactive program, and if you have any questions for Dr. Mark Moodley or for Jamila Mayed, then you can forward them to us via WhatsApp on 060-904-1056. I repeat, 060-904-1056. The topic for discussion is Down syndrome. Just to remind you that doctors and guests on the Medical Files program will help you with any medical problems you pose by giving you advice on air. However, they do not have your full medical history and have not examined you. Please verify the advice given to you on air with your regular doctor who knows your medical history, allergies, etc. Neither the doctors nor the relevant radio station nor the Islamic Medical Association of South Africa will take any responsibility for any adverse reaction caused by the advice given on medical files. Our topic, as said, is Down syndrome. And of course, we talked to Dr. Mark Mudley, a specialist pediatrician, and Jamila Mayat, a registered behavior therapist who also practices in Durban. Now, Jamila, how can parents and caregivers effectively support behavior therapy goals at home?
So with parents and caregivers, in order to support behavioral therapy goals at home, they would utilize and implement strategies that are recommended by a behavioral therapist. In order for you to see like consistent results, you have to be consistent in your reinforcement. So that also applies to if your kid is recommended medication, you have to be consistent with your medication. So similarly with behavior reinforcement, in order to extinguish certain behaviors or replace it with appropriate behaviors, we have to be consistent in our reinforcing. A structure, generally with anyone on the spectrum, structure and routines help. So if your daily routine at home or the structure at home is predictable for the child, especially those that are nonverbal and are struggling with communication barriers, it is helpful to them to know what's happening, for it to be predictable, so that they can prepare themselves. It helps them to transition from an activity or from one place to another. It also reduces the anxiety of the child, mainly for those with communication barriers, because they don't know what to expect. And it is challenging for them to effectively communicate their needs to those around them because they struggle with verbal communication. Another thing would be collaborating closely with your therapist or your doctor or any practitioner that is helping you in addressing certain behaviors, being open and honest. If you are seeking help, it's not a situation where you need to hide or you need to feel ashamed or you need to feel judged. If you are seeking assistance, be open and honest so that the practitioners can help and assist you in the best way possible. Hiding information or feeling ashamed to let therapists know that, okay, you're struggling at home or the child is displaying certain behaviors as well at home, limits the data that they can receive from you in order to identify, like you said, patterns in behavior to give you the proper intervention.
Yeah, Jamil, I think that's quite important because when one is faced with a diagnosis such as this, where they're exposed to stigma from society, the key is acceptance, accepting it. And when you accept something, management becomes a lot better.
Yes, 100%. And also, I know that a lot of parents, if it's the first time that they're experiencing a child with a diagnosis, it's the first time that they're seeing, okay, what is this? I don't know. I've never seen this. Never happened in my family before. It can be very daunting and very scary. And the shame or the judgment that they place on themselves actually slows down the process of intervention.
Yeah.
Early intervention for any special needs is so important, because the sooner you know exactly what the diagnosis is, the sooner you know which steps to take.
I agree.
Mark, I think you want to add to that.
I think it's correct. Even in our previous shows, we spoke about disorders like autism and ADHD, where parents are anxious about it and don't want to come out about it because society often puts labels and tags onto these situations. In the older days, there was a term called mental retardation, which we have eliminated in the medical community because when you expose something like this to the community, they would associate this as being somebody that's vulnerable, somebody that's fragile, somebody that cannot get a job, have a normal relationship. But once we accept that these are disorders we cannot prevent or avoid, we make management easier. And as Jamila said, communication is so important because once a child loses communication, it affects the child whole as a being, development-wise, relationship-wise. So accepting and overcoming this challenge should be what we should aim for at this stage.
Two questions have come in questions from two different listeners have come in thus far. Salams, how does a mother react to family and friends who mock her daughter who has Down syndrome? I'm opening the question to both of you.
Okay, so as a pediatrician, I don't think it's right for them to do that to her. this is not something that mom could have prevented. This, like I've said initially, it is an inherited condition. So I think the mom should speak to them and educate them. That is why we have these shows, so that our community can be educated. And I think if it still goes on, then mom should set her boundaries there, because a child is her priority.
Jamila?
I 100% agree. I think you would treat it the same way as a neurotypical child. If you had a neurotypical child and the family was mocking them or harming your child, psychoeducation is 100% the way forward, where you would set the boundary, hold them aside, hold them accountable. I think the best way to curb the behavior would be to address it immediately. So if you notice something happening within your family where a certain person or an individual sends a remark or passes a comment or starts the whole process, cut it off immediately, address it there and then, and say, this is not appropriate.
Yeah. Jamila, this mockery and sort of stigma from society towards these children, it is growing at quite a big speed. And I think it's so good to have these awareness talks and programs so that our community is educated, because they think sometimes that the parents are responsible for this, not knowing that this is a gene, this is inherited.
Yes. So a lack of education on the topic is where, like, you could identify as the cause of this ignorance, if I can say that. But also the culture of mom shaming, where everything that happens with the kid is the mom's fault, which is a terrible thing that we have with in every community. We have like a bunch of mom shamers. So it does happen even for neurotypical kids. So to the mom, don't take it personally that it's just because your kid has Down syndrome, they're being picked on, because it happens with even neurotypical kids that don't have any diagnosis.
Okay, question that comes through is, Assalamu alaikum to all, very informative program. I do appreciate it. Okay, I'm asking for my grandchild. He was 8 months baby and he was diagnosed with ADHD. He's in special school, St. Christopher's, and still seeing a psychologist. And he recently diagnosed him with ASD. Please, can you explain a little bit more about what is this? Now, I know this is off the topic, but it seems to be related.
Faisal, it's definitely related. These children do tend to have behavioral symptoms, and this might be an underlying ADHD. We did give a whole talk on ADHD, and you need to meet certain criteria for that child to have ADHD. But what we do find is that a lot of kids born with Down syndrome do develop autism spectrum disorder. So there is a correlation between Down syndrome and ASD.
And incidentally, this child is 13 years old. The question.
13,
yes.
Yeah.
Okay, I think we've got like 2 minutes for the break, but there's another question that's come through. I have a 7-year-old with Down syndrome who has hypothyroidism, and he's on Altroxin from birth. At the moment, he takes 50 and 75 milligrams on alternate days, which is quite high. I'm afraid that he grows, and as he grows, the dosage will increase. What is the way forward? Also, can a GP monitor his condition, or do I have to go to a pediatrician or a specialist?
Okay, I think we are coming to the medical complications of Down syndrome, where I was going to explain that hypothyroidism. So for our listeners, hypothyroidism is a low amount of thyroid hormones, and thyroid is like the second brain in our body that regulates everything in our body. So these children do develop hypothyroidism and should be put on treatment. I think when it comes to a situation like this, the management should be multi-disciplinary, not just the general practitioner, but you need to have your pediatrician involved, and most importantly, in a case like this, a pediatric endocrinologist who's trained in hormonal problems to treat this condition, because hypothyroidism on its own can contribute to behavioral aspects as well as poor performance in school.
What you identified at the moment would have been something that if this kid had come to me for behavioral assessment, we would have determined that it is from a hormonal influence. And therefore, behavioral therapy may not assist in combating these challenging behaviors because it's a symptom of their hypothyroidism.
Okay, we're going to need to visit the marketplace. And on the other side of this, the question that comes is, Assalamu alaikum, doc. Can you explain what is euthyroid and how it affects the body? But right now, we need to take an ad break.
We'd love to meet you. Pay us a visit. Radio Al Ansar,
Get ready to celebrate the joy of the season with the Chelino Baby Sale. Shop beautiful baby nursery, furniture, travel systems, car seats, and much, much more. We've got everything you need to make this holiday unforgettable for your little one. Shop the Chelino Baby Sale from the 20th of March to the 20th of April 2024 for a unique and fun shopping experience.
on 031-208-1601.
Lillah only. Make a meaningful impact this Ramadan. Together, let's share the reward of the sacred month.
Darwood Megastore takes 7.
Darwood Megastore. More. What's the line again?
More cluck for your buck. Take 14.
Darwood Megastore. Fiddling South African place since 1947.
What? No. The line is take 22.
Darwood Megastore. The friendliest staff and...
I can't take it anymore. More cluck for your buck at Darwood Megastore in Briardine, Wilson's Wharf, and now PMB.
Ramadan, a month to go beyond our ordinary. Praying more, giving more, connecting more. Join Africa Muslims Agency to feed the fasting for 110 Rand per day. Provide a grocery hamper for 1,600 per month and feed a village or camp for 17,000 Rand per day. Every donation goes beyond just food and water. It transforms lives, empowers communities, and brings the spirit of Ramadan to thousands in need. Together, we can bring hope to families in Gaza, South Africa, Mozambique, and 18 other countries. This Ramadan, go beyond with AMA for a better world.
Calling all chicken lovers, dive into flavor paradise at Mr. Bird. Sink your teeth into our mouth-watering pan-fried chicken burgers, loaded fries, tender tenders, and juicy thighs. Brave the heat with our dung-fried chicken burgers drizzled with hot honey and oozing with dung cheese. And for the daring souls, conquer our Nashville hot chicken burger. Yeehaw! Visit us at Cowie Food Park, 123 Cowie Road, next to Checkers. Get ready to taste the crunch at Mr. Bird.
Swipe and save extra at Checkers Foods Cowie Park with deals like Nescafe Gold Cappuccino Sticks, 10 per pack for just $59.99, saving you 15 Rand. House brand sunflower seed oil, 5 liter for just $119.99, saving you 30 Rand. Lindt Lindor Cornets, 200 grams for just $129.99, saving you 40 Rand. Deal valid until April 7th at Checkers Food Cowie Park only.
Radio Ansar.
You're listening to Medical Files on Radio Ansar, brought to you by the Islamic Medical Association of South Africa and presented by myself, Faisal M.J. Suleiman. We are discussing Down syndrome, and our guest on the show this morning are Dr. Mark Mudli, a specialist pediatrician practicing at Mshlanga, and Jamila Mayat, a registered behavior therapist who practices in Durban. And of course, this is our topic for discussion is Down syndrome, and this is an interactive program. You can forward to us any questions that you might have on Down syndrome or via WhatsApp on 060-904-1056. Now, I did mention just before the ad break a question had come through. Assalamu alaikum, Doc. Can you explain what is your thyroid and how it affects the body?
Okay, just for our listeners, our thyroid gland is a gland that's located in the neck area. Like I've said, it's like our second brain, responsible to a lot of processes and metabolism that happens in the body. You can either have low thyroid hormones or high thyroid hormones. But if your thyroid gland is normal with a normal production of hormones, that's euthyroid. So if a child has hypothyroidism, which is low thyroids, and you give this child medication and normalize the thyroid hormones, this child is now referred to as euthyroid.
Okay, Assalamu alaikum. A family member is Down syndrome. She is in her 20s She was treated as a normal child, and alhamdulillah, her mother also did a lot of therapy, but now she wants to get married. How do we deal with that? Also, please advise what kind of exercises and stimulation that can be done with the Down syndrome child by the family, especially those who can't afford specialist treatment.
Okay, that's a quite a good question, because I wanted to bring up. I'm not sure if you've seen on Netflix and all our TV shows now. There's actually shows for dating, Down syndrome people dating. And this is creating awareness that these people or these children can actually grow up to have normal relationships. Jamila, have you seen that show with Down syndrome dating?
No, I haven't watched it.
It's quite interesting.
But I have heard about it. Yes.
Yes, but obviously that's not advisable. I mean, yes. Okay. And say we don't agree with that.
We don't promote dating, but I
Mhm.
think what doctor is trying to say is that maybe if the families want to maybe use this as an educational platform, just to understand the factors around getting them to like meet each other, or what does it entail, maybe from an educational perspective, it might be helpful. Even though we don't promote dating
Absolutely.
in Islam.
Yep.
Okay.
Also, doc, please advise what kind of exercises and stimulation that can be done with the Down syndrome child by the family, especially those who can't afford specialist treatment.
Okay, I think with exercises, these children are very floppy, so they don't have good muscle tone. So regular, normal exercises can help. Going for a run, going for a jog, taking the child to the gym, getting them involved in these activities can help. But I think your best way to go here is to go to a physiotherapist, occupational therapist, because this is a multidisciplinary sort of management. But if it's not affordable by the patient, exercising can increase muscle endurance and muscle strength.
Asking for a friend.
Can I just interrupt you quickly?
Sure.
For those people that can't afford therapies, there are a lot of resources where you are you have access to affordable therapies, or even therapies where you don't have to pay. For example, UKZN, they students do therapy for the public. I think it's at a very reduced rate, if I'm not mistaken, or even free in some cases, like speech therapists and OTs at UKZN in Westville. So there are resources that you can go, like, or pathways that you can find where these therapies are really reduced and affordable.
Yeah,
So there
I
are options
did
available.
see there are a few groups in South Africa for Down syndrome. Maybe they can contact these groups and see what's available for children that can't afford to go to therapy.
100%.
And
Yeah.
in fact, the Islamic Medical Association also has some of these facilities available. If you
Okay.
contact them, they will guide you and direct you.
Gee, so there
to
are options.
There are definitely
There are
options, undoubtedly. Of course, the sister says, I'm asking for a friend. My son is 8 years old with Down syndrome. His concentration at school is very poor, and I started him on Ritalin. There was a complete change. He became emotional and didn't eat the whole day. I gave him for 2 days and couldn't see my child like this, so I stopped it. Please advise, is there an alternative to Ritalin?
I think starting this child on Ritalin, one needs to confirm the diagnosis that this child indeed has ADHD. So I'm not sure if that was done. And Ritalin, one of the most common side effects is a loss of appetite. So I think this mom should go back to a medical health practitioner and bring up the issues, because I think we mentioned on previous shows, if you give treatment for ADHD and if the treatment is not working, it might not be ADHD, it might be something else. And Jamila did bring up numerous problems where they present with behavior and hyperactivity.
Yes.
Doc, you did mention that a child is born with Down syndrome. Now, can this be picked up while the mom is still pregnant?
Yeah, for sure. Down syndrome can be picked up. So it can be picked up with the blood specimen taken, where they look at the chromosomes and they see that instead of a set of chromosomes on number 21, there's 3 chromosomes. One can also look for features of Down syndrome in the fetus. And one of the common symptoms of Down syndrome is a short, thick neck. And when you look at the fetus, it's easy to visualize the neck structure. You will see that thick, short neck on ultrasound.
Mhm. And let's talk about diagnosis. How is Down syndrome diagnosed?
Okay, so with diagnosis, when the baby is born and the pediatrician is attending to that baby, the features of Down syndrome, it can be subtle, but it's not that difficult to find. They have very obvious features, but you need to, you just can't find one or two features like an eye feature and a feature in the palm and say this is Down syndrome. You need to find a few of these features and then look at risk factors and then do a blood test and then confirm the diagnosis.
Mm-hmm. And I think I did ask you what were the signs of Down syndrome. You've mentioned it a few times already. Now, Jamila, how can parents and caregivers effectively support behavior therapy and set these goals at home? How can I think they play a huge role, I think.
Gee, they do. Like I mentioned previously, that each child would have a specific and individual needs with regards to behavior management or behavior goals. So working collaboratively with your therapist or with your multidisciplinary team, because at times you have kids who require like speech therapy as well as behavior therapy, OT as well as other therapies. So working collaboratively with your team to support your child and reinforcing the goals that are being introduced or established during therapy can really help. Being involved in the therapy process, not just expecting the therapist or the practitioner to fix the child, because that's not going to happen. Unfortunately, we would love for that to be that way, but it's not something that can just be magically fixed. You have to understand it as well. Take the time to understand your kid's diagnosis and work collaboratively and consistently with
Jamila, that was a very good point. We should not focus on fixing the child, but identifying this child's specific needs and attending to those needs, because every child with Down syndrome is different. So it's an individual-based assessment.
And the same can be said for even children without a diagnosis, like neurotypical kids. 100%. All of them are different as well. And the needs from their primary support group or their caregiver would be different. It would vary. So the same way we would treat neurotypical kids, we would also treat neurodiverse kids.
Mm-hmm. I heard that the terminology neurotypical, neurodiverse a few times during this conversation. For the benefit of our listeners, you'll just explain what is neurotypical.
Neurotypical, so a neurotypical person is a person that has normal wiring of the brain, and neurodivergent refers to that abnormal wiring. It's more used in children with autism spectrum disorder, Mm-hmm. So we call it neurodivergent, neurotypical. So we don't want to put labels into these children, and we want to use terms that's acceptable.
Absolutely, it's absolutely vital, because it's absolutely vital, because the psychological effect that this terminology has, and also unfortunately, and a huge unfortunate, the stigma that the community and the people attach to these type of conditions, it's quite problematic. So it's we need to use, I can't say politically correct, but acceptable terms for these things.
Faisal, what Down syndrome? It was actually identified by somebody called John Langdon Down. That was his surname.
John Langdon Down.
Yeah.
Okay.
So that's where Down syndrome came about. And if you look at very old paintings, years ago, when you look at paintings, you will actually see pictures of people with Down syndrome. And they will describe this child as having Mongolian appearances. And Mongolian is also a very harsh term to use, so that we eradicated that term. But if you look at these paintings from years ago, that's you actually see people on those paintings with Down syndrome features.
Yep. Our topic for discussion is Down syndrome. I've got a question that's come through, which is, I don't think it's related to Down syndrome. I'm just going to pose it, and you're not obliged to answer this. She says, Salams, I'm a female and I'm losing a lot of hair. Can you advise on what supplements to take? I'm on Lipitor and other BP tablets. I don't think it's Down syndrome related.
No, I don't know. It's not Down syndrome related, but I will advise her to maybe go to a dermatologist.
Mm-hmm. Mm-hmm. Okay. 060-904-1056. We are discussing Down syndrome, and of course we have Dr. Mark Mudley, a specialist pediatrician, and Jamila Mayat, a registered behavior specialist therapist practicing in Durban. And Dr. Mark Mudley, what are some of the medical concerns in children with Down syndrome?
So these children can be predisposed to a lot of medical conditions, and our big concern is that 50% of these children, half of them, will have something called a congenital heart defect. So I think the community is aware of a hole in the heart, if I had to break it down into simple terms. So they do get a hole in the heart. So it's important to refer these children to a pediatric cardiologist to do a scan and see what's the hole in the heart, how do we manage it further. They can have, a lot of them have intellectual disabilities that Jamila can pick up on. They do have abnormalities in the neck area of your spine where they have instability. They can have problems with the bowel. The bowel doesn't form completely. Okay. So and they can also have, males may have problems with fertility, so may not be able to conceive as they grow older, but women can have chances of conceiving as they get older.
Now, talking of women conceiving, what is the chances of the child that's going to be born coming up with a similar condition, being born with a similar condition?
Look, every child is different. Studies have shown that some women are able to conceive and some women are not able to conceive. So we still need to do more research around that area.
Jamila, can you provide some guidance on setting realistic and achievable behavior goals for individuals with Down syndrome?
In order for families to set realistic and achievable behavior goals based on each child's behavioral strengths. So to be realistic for your child's expectations is to understand your child's abilities first and foremost. As previously mentioned, we did say that having the child diagnosed properly, not just guessing that, okay, the child looks like this, so this is what it must be. Having the proper diagnosis is where you would start. And then seeking assistance through a qualified practitioner, such as either your GP, which generally is your first point of contact, and thereafter you would be referred to either like a behavior therapist or an occupational therapist to assist. Behavior goals based on the child's individual strengths and needs and priorities. Goals may focus on areas such as their communication, social skills, independence, and behavior management. So these are just some of the areas that we look at in therapy, and not all of it will be addressed in each child. So some of them may be able to communicate perfectly, but you will notice that they have a trait of stubbornness, which you need to work on that specifically. Or you would find that they have an attention deficit during work time, or there's specific behaviors where if you're expecting them to now use the bathroom or transitioning through certain activities, then there's meltdowns or there's episodes. So like I just mentioned, prioritize their needs, prioritize their strengths, understand your child's interests, and then from there you can set those realistic goals. You can't just say, okay, I expect my child to be a medical surgeon, but the child has no interest in that. They struggle with communication. They have processing disadvantages or struggles internally, where you are setting unrealistic expectations on their development. So understanding the child at their core is where you start.
Dr. Murli, I think this question is more for you. Salam, what is the difference between Down syndrome and a microcephalic? That's that right? Am I pronouncing it correctly?
Faisal, these listeners are really giving you the medical terminology.
Absolutely. As long as I'm pronouncing them correctly, that's important.
You can say microcephaly or microcephaly.
Safely.
So, yeah.
It's safe to say safely.
Okay.
But let's go for it.
So Down syndrome is a disorder where there's an abnormality with a 21st set of chromosomes, which is genetic and inherited. They can have a small head. Microcephaly is having a small head. But the causes for small head is vast. It's not just Down syndrome. There are other syndromes, for example, fetal alcohol syndrome. So that's the difference. So microcephaly might be a sign of Down syndrome, but it's just a sign. It's not a diagnosis.
The question that I want to put to you is, when a baby is born, then the baby is obviously examined by the pediatrician, etc. At that stage, can it be sort of determined that this baby's probably got Down syndrome? Because obviously you spoke of certain physical conditions,
Yes.
physical symptoms.
Yeah. On rare occasions, can the presentation be subtle? But when the baby is born and you examine that baby thoroughly, you will be able to pick up the features. A lot of them may not have overt facial features, but when you look at the palms, you will see that single line. Or when you look at the feet, you will see that sandal gap. So that should raise suspicion that this might be Down syndrome. And you need to go and look at that mother's age, because moms over the age of 35, even dads, that's advanced maternal age, those are huge risk factors for Down syndrome. It actually lowers the risk, increases the risk drastically from that time.
Mm-hmm. Worrying. And a question that comes up is that can a child born with Down syndrome lead a normal life?
Jamila, I'll leave this to you.
Okay.
Again, it also depends on the severity. It depends on the child individually. But yes, they do have the ability to be integrated into society. It just requires a lot of psychoeducation. It requires a lot of support and early intervention. But yes, they can.
Alhamdulillah, that's the most important answer that I'm looking for, that they can. Dr. Mudli, what are some of the challenges that the doctors face when it comes to Down syndrome?
I think it's not much with the doctors, because most of these conditions are treatable. We need to speak to the parents. Like Jamila said, the first point of contact might be a healthcare professional. So we actually need to sit with them and advise them on this condition so they can understand better and educate their family members. These children do have a lot of ear infections. They come through with a lot of ear infections that needs treatment. I think referral to a psychologist is important to help the parents accept and understand the situation. And one should always bring up the issue of genetic counseling. Seeing a genetic counselor if you plan on conceiving after the age of 35, because that increases your risks.
Mm-hmm. Jamila, are there any strategies or techniques for promoting independence and self-help skills in individuals with Down syndrome?
Yes. So one common issue that I find in therapy is that a lot of parents with children with like Down syndrome or other special needs is that they coddle their kids a lot. So they coddle their kids a lot.
Okay.
So when a child, even like previously mentioned, a child without a diagnosis is coddled, we actually hinder their independence and we hinder their growth. And in many situations, the child will say, I want to do it myself. And we'll say, no, let me help you. So that is one way we can curb that, where we can allow our kids to do the things that they need without us being there. As much as parents or caregivers, we want to help them and we want to spoil them and we want to love them. Sometimes over-loving can be a hindrance. From a behavioral therapy perspective, to promote independence and self-help skills with Down syndrome is we can teach them adaptive skills for their daily living tasks, promoting problem-solving and decision-making skills, and fostering autonomy and self-determination. What that means is that we can, through their day, we can promote that independence through them. So teaching them, showing them how to do things, allowing them room and a safe space to make mistakes without over-punishing or overreacting to certain things, because they learn through that process.
Mm-hmm.
Jamila, that is a positive reward system, am I right? If they do something correctly, then you...
Yeah, so reinforcements, positive reinforcements.
Yeah.
And that doesn't necessarily mean you give them a treat or you give them a candy, but you can praise them. Praising a child is a positive reinforcement. Reacting appropriately to something that they've done, where they've made a mistake or they've spilled something, not having that outburst, oh my God, you messed. That is a negative reinforcement. So by being understanding and accepting in that situation and saying, for example, it's okay to mess, we'll just clean it. That can be a positive reinforcement to the child actually trying again.
Because with the negative reinforcement, that's going to be programmed in that child's mind. And that child is going to be made to believe, like, I'm not good enough, I cannot function. And this will go into adulthood.
And it will also hinder them from actually trying new things in future, because like you mentioned, they won't think about it as the act was, okay, I spilled this, I did something wrong. They will feel like they are not good enough.
Yeah.
Mm-hmm.
That is how they would interpret it, that I am not good enough. And it would really affect their self-esteem.
Dr. Mudli, how do we prevent Down syndrome?
So we cannot really prevent Down syndrome. It is a genetic condition. It's inherited from parents. The gene can come either from the mom or the dad. I think if you're a mom that's more than 35 or dad that's more than 35 and you're planning on conceiving, I think it's best to go to a genetic counselor. If you're more than 45, you should definitely go to a genetic counselor. But it's something you cannot prevent. And if you do have a baby with Down syndrome, I want to tell you that it's not your fault. There's nothing you could have done to prevent this. This is inherited. And I hope our community listens to this and stop judging and stop criticizing, and accept these children for who they are, because it is a beautiful condition.
In fact, the next question I don't want to ask you, but I mean, a listener sent it, forwarded it to me, and said, I'm obliged to ask you this question, but what is the life expectancy of a person suffering from Down syndrome?
Okay, so with proper treatment, adhering to your medical practitioner visits, visiting healthcare professionals like Jamila with behavioral aspects, doing everything by the book, you can have a life expectancy of up to 60 years.
Okay.
So that's close to a normal person.
Pretty normal, yeah.
Yeah, there is a woman currently living who's 82 years that has Down syndrome.
Okay, no, that's excellent. Also, I'm sure there must be other medical conditions that are commonly associated with Down syndrome.
Yeah, I think we went through many of the medical conditions, your heart defects, your bowel problems, problems of frequent otitis media, which is ear infections, and with a tongue that's protruding at birth, they may have feeding difficulties. The main problem that we should address, I think we should address all the problems, but most of these children have intellectual disabilities. So we need to work around that. So when this child turns 18, this child can be independent and function as an independent adult.
And technology is advancing all the time. Medical technology is advancing all the time. And what advancements have been made in understanding and treating Down syndrome?
So with advancements, we are doing advancements. It falls beyond my scope because the baby comes to me once. I catch the baby, so that's when I see it, and then I can intervene. From an obstetrician point of view, there may be more tests being done to pick this up early. I think screening is very important. But once you identify that this baby is having Down syndrome, one should go ahead with immediate referrals. Earlier the treatment, better the outcomes.
Time for us to round up, unfortunately. I see Jamila, you smiling, but what happens when you're having fun, time flies. Okay. I want to thank both Dr. Mahmoodli and Jamila Mayat for having joined me on the program this morning. But before I bid you farewell, Doc, your message to our listeners first. It gives Jamila a few moments to formulate her message.
Okay. So I want my final message is very short. Down syndrome is a common condition. Children with Down syndrome don't need our pity. They need our love. They need our care. They need our nurturing, and they need our support. And I think especially to our community, let's accept these kids for who they are and make them a part of our community so that we can achieve what we want when this child becomes an independent adult.
Jamila, your message?
Just something on a lighter note. I just feel that Allah blesses everyone with different challenges, and He blesses you, and I'm using the word blesses you, with the challenges that He knows that you are capable of managing. So that's something that everyone should remember. And to the parents as well, it can be very daunting and very scary, but just remember that you can do this. Whatever it is, whatever challenge you are faced with, you can overcome.
And you will be rewarded for it.
Of course.
Absolutely. Dr. Mahmoodli, Jamila Mayat, thank you very much, and Jazakallah khair for joining me on the program. It's been wonderful talking to you, and all the best to you. Shukran. Assalamu alaikum wa rahmatullahi wa barakatuh to you.
An informative Islamic global perspective. This is Al Ansar News.